stuff that our team is now looking at when it comes to trauma is around. We've got an awesome PhD student, Vita Pilkington, who's now getting started looking at sexual trauma in young men and how that impacts on the way that they're going to engage in psychotherapy and the barriers to help seeking as a result. And there's some really frightening evidence, showing the delayed responses that exist when men go through a really traumatic incident in their early years. It can take over 2 decades before they seek help, put up their hands and start to process some of that stuff. And I think that there are many reasons for that, which again, I'm sure we're going to unpack. Many of them are socialized around, masculinities and the notions of stoicism and self-reliance and what sexual trauma specifically as well, what that suggests in many ways, and the way that what the underlying narrative is that men who have been abused hold in many ways. And so I worked in an HIV clinic for about 1.5 years, mostly with, mid to late 50, 60-year-old men who had been through, the AIDS epidemic and survived it. And they had, really, really full-on stories that they had never voiced to anyone in 20, 30 years. And so I think we really require, and I think the field is getting a lot better at dealing with trauma, and even the fact that trauma-informed care is like everywhere now, as is cultural competency. There are certain things which are just in the zeitgeist, but I think that it's going to be really exciting to see a lot more research coming out about male trauma. We've done quite a bit of research in PTSD in veterans, for instance, and there's a nice bit of work there, and that's due to funding largely from that side of the world. But I think that understanding your everyday violence, sexual assault and abuse amongst men, and starting to get to the bottom of how to actually provide that safe space that Dave is talking about, to let them feel able to disclose. And the fact that disclosure looks really, really different. All of the guys that I work with clinically will disclose things at different times and in totally different ways with different language. So our expectations need to broaden, I think, if we're going to be able to actually attune and tailor our responses to them as well.